If you're looking for a new dentist, you should definitely choose Blue Line Dental. And some of those reasons are based on how we practice, the type of dentistry that I'm trying to provide. Here at Blue Line Dental, we do evidence-based dentistry. So any procedure that I do, any product that goes into your mouth, the cements, the porcelains, we choose them because they are backed by a ton of research, which is important to me. I think when I'm placing something in someone's mouth, I want to make sure it's biocompatible, meaning that it's going to work in your mouth for years to come, that the products are safe, and that they are very comfortable. That's one reason. Another reason is I do value comfort. I really do think that when you come to the dentist, you should be comfortable. It should not be a scary place. It should see you come in, you should want to get that cleaning. It should feel refreshing to get that cleaning. And I think at Blue Line Dental, we achieve that. When patients come to us, they are happy to come in to get a cleaning. They are happy to see the things that we provide, and they are reassured by knowing that I am providing the best quality and care that I can provide. A benefit of being a Blue Line Dental patient is that you really do become part of the family. We are located in Midtown Manhattan, here in the heart of Sun Place. I live in the neighborhood. The office is super accessible, and we're very inviting. If you're walking down the street and you just had a question, like something felt off and you just wanted to get me face to face for a second just to really calm down your nerves that something is going on, I'm here. I'm close by as well. If it's an emergency, I can walk in. I have been here on Sundays to help patients that have called me in pain. So I think that is probably one of the biggest benefits of coming to Blue Line Dental, is that you can always come to us when you're in need. You should never feel, and we would never make you feel like you shouldn't contact us at any point in time. I will come in and help out my patients because I'm part of the community and I want to help that community. So when I was trying to decide how I can provide to the community here in Manhattan, I knew it was important to consider people's schedule. We are known for working hard, and it can be hard to find time to come into the dentist, so that we do a few things to help accommodate that. One is later hours. We open some days till 7 p.m. We also open Saturdays to help accommodate patients that can't come throughout the week. And I think one of the more interesting things in New York is I have so many patients who come in during their lunch hours. So they gotta get in and get out in time just so they can fit it into their day. So we really do accommodate patients in different ways to fit that New York lifestyle, or to fit a busy lifestyle that has work or kids. There are many different options that we've created for patients to make it accessible. My team and I really strive to make patients feel part of the family. I think that if we can connect on that level, we can provide much better care. When patients trust us, trust the team, trust me as the doctor, and our recommendations, I know that we have stepped beyond the level of just like patient and doctor to something closer, because it is important to feel that where you're going to the dentist is somebody who cares about you, who is trying to provide the best kind of care for you. So at Blue Line, that's what we do. We try to communicate, we learn about our patients, what is important to them when they come to the dentist, so we can always take those things into account. But we go beyond just learning about what their dental needs are. We learn about them, what they do, their families, if they have kids. I like to know these things because it really does help me build a connection with my patients. I want to know if your daughter graduated college, or did your son get his first job. Things like that are important to me. I think it really does change the experience. I'm a family dentist. That is what I've always wanted to be and to provide. I've worked in family practices my whole life since I was 16, and I knew from the moment that I jumped into one that that's what I was going to provide. So my team and I care a lot about our patients, and bringing them into our family is important. So when I set out to create Blue Line Dental, one of the things that I knew was going to be really important to me was creating an environment for my team that they would feel valued, where I can provide something to them that I knew was important. for those that don't know, I had been in dentistry since I was 16 years old. I started off working in administration, then I became a dental assistant, and then I became an orthodontic assistant, eventually went on to dental school. So I know what it means to be a part of a dental team. And when I was thinking of how I wanted my dental team to be, I knew it had to come from a place where I valued my team, where they felt that I valued them. I wanted to give them enough to be able to support themselves and their families. All of that mattered to me because they are people I spend my entire day with. They become part of that Blue Line Dental family, and it's important. I think it's important. Just like I would take care of a friend or a family, that's who my team is. And that's what's different about Blue Line Dental. If I can describe Blue Line Dental in one word, I think it has to be family. I for sure 100% family. Like, that is what we are about. In fact, I even have it on the window right behind me. It says family dentist there. I've always wanted to be about families. I have a family of my own, and it really just, it's in our vision. It's super important. That's who we are.